Okay. All right, friends. Welcome to our guest speaker for Heart Health Month. And do you like Anna or Anna?
Anna.
Okay, that's one of those names I'm always like, am I saying it right? She is a member of our club, which is super awesome, but she's also a, very smart medical professional that's going to talk to us about heart health in general. And then we have a couple member questions we'll get to, and then just some general heart health questions. We'll get to what we can. And at the end of the talk or the I'm sure we'll all just feel really informed and just supported in this topic because it is very important. I even double checked, and I'm sure you're going to have some stats for us too, but double check that. I'm like, I hope I'm saying this right, but heart disease is the number one killer of women, right? And I don't think we hear a lot of like breast cancer or diabetes or obesity, and all those things are, I think, it's in the top five, but that heart health is the top and not necessarily 100% not preventable, but there are things we can definitely do to keep our heart as healthy as possible. I'm like, why are we not talking about this? So I am
Yes,
super glad you're here. So give us a little bit, who you are, where you live, what you do, your backstory, and then we can dive into some questions.
definitely. Well, thank you so much for having me, Becky. I'm so excited to be talking to all of you today. My name is Anna Matthews. I am a cardiology nurse practitioner in South Denver, Colorado. I work for South Denver Cardiology, which is the largest group in Colorado. And I met Becky through our church at Momco, and I'm so grateful that I joined this community with you all and just have her as a mentor and friend in my life. I am very passionate about heart health as I work in it for my career, but also I'm very passionate about fitness and wellness. I have a history of doing some bodybuilding some years ago, which was really fun and probably the hardest thing mentally I've ever had to do with the nutrition and workouts and posing and just mental prep for it. But it was probably one of the most rewarding things I've ever done too. I love Orange Theory Fitness. That's my favorite kind of workout. And also just hiking, spending time in Colorado with my family and our dog. Yeah, hiking, being outside. I have a little boy who's 3, and my husband Dan and I are also expecting a little girl this summer. So we're very excited about all that.
So exciting. When is your due date? I'm not always so
Uh,
curious.
July 26th.
Okay, yeah. So you got a little while to go, but
Yeah.
all my babies were born in the summer, so I totally get by the end you're just like so hot and like ready to be done, right?
Yeah.
So yay, we'll be definitely praying for health and wellness and all in your whole, pregnancy and fitness journey. But give us some feedback of how because when I first met you, and I found out you worked in heart health and I was like, oh, let me see if she'll be a speaker. I went onto your Facebook profile. I was like, oh, because you've done a bunch of things. Like tell me a little bit about did you start in exercise science? Was that like how did your path end up you here in this
Yeah.
role?
Great question. So I went to Colorado State University for undergrad, was pre-med, not sure kind of what direction I wanted to go, and got a degree in health and exercise science with a focus in sports medicine. Really started falling in love with the heart then. Just the physiology of it, the kind of preventative medicine portion of heart health, and then um, even did research in cardiovascular health while in college, and was also published in a journal, which is I'm really proud of. And then, actually, before all that even started, when I was a senior in high school, my mom was having a heart attack, and
Oh my
I
gosh.
was, yeah, worried because she just kept having acid reflux symptoms. And I said, "Hey, mom, I think you're having a heart attack. Let's get some aspirin. Let's call 911." And what is so cool is she went to the hospital. She did great. She had a stent placed. And her doctor took me back to the cath lab and now is one of my colleagues. And he was the one who got me into wanting to work in cardiology. And so it's so cool how God just kind of had it all work out where I ended up there. But right out of nursing school, I worked at University Hospital for 5 years in the ER and then went to nurse practitioner school, and after that, I went and did a really rigorous fellowship in internal medicine with and critical care Then went to work at Denver Health's ER for 3 years, and then worked in cardiac surgery for a couple of years. Not actually in the OR, but in the ICU, managing the post-op hearts, and just knew I always wanted to end up there. And then came back to kind of like that area that threw me into what I wanted to go into, and a better work-life balance with my schedule. So I'm really grateful as a nurse practitioner, I have that kind of flexibility, and I've been able to experience a lot of different things.
That's amazing. I mean, you're literally an expert in this field. And so that's why I was like, when I saw the phone, I'm like, oh, wow, let's see if she'll talk to us. So appreciate you sharing. I mean, obviously you put in the years, you put in the work, the education and the practical side of this. So I feel very confident that you're going to give us some great information today. So I have just a couple questions. We have a few membership questions, from the ladies in the group. And then obviously at any point, if there's anything that you're like, okay, I really love to talk about this because I feel like this is important for us all to know, like we don't have to stick to the script. Okay. So feel free to, give us what you think would be the most helpful. Because I think a lot of times with all health, nutrition, and wellness, it can be overwhelming. Like there's so much information out there. Like at one point, eggs are bad, and at one point, meat is bad, and you probably could find data supporting both of those things and then exactly the opposite. And so I appreciate you kind of like distilling it down for our non-well trained brains and lives, and giving us some tangible tips. So what do you think are some of the common like heart health myths that are out there?
Yeah, I think one of the biggest ones right now is that statins are bad. I have a lot of patients come in who meet criteria to kind of talk about going on a statin. We've tried lifestyle modifications, and I try to remind them, like we can eat really healthy, work out, de-stress, get good sleep, but the one thing we can't control is genetics, which is often a huge component to cardiovascular health. And I mentioned, hey, I'd love to get your bad cholesterol a little lower. Would you consider going on a statin? And they're like, well, my sister told me they're bad, and my neighbor said that they cause Alzheimer's and all these different things. And I'm like, okay, well, let's break down the data and the research. And basically, statins are old. They've been around for a while. They work really well, and they do a really good job at lowering the LDL, which is our bad cholesterol, which is a major risk factor to having cardiovascular disease. And when I talk about cardiovascular disease, I'm talking about plaque buildup in our coronary arteries. So there's three main arteries that feed our heart. And if there's a blockage in one of those, that can be detrimental. It can cause irreversible heart damage and can cause death. And that's why it is the leading cause of death in women. And so I bring up statins and want to just talk about that. So I think that if ever your primary care doctor or your cardiologist recommends you being on a statin, I think hear them out. And I'm always happy to talk more offline with someone too if they want to talk about it and the data kind of behind it. But like any medication, there's some risk of having side effects to it. And I think that's one big thing. Are people like, well, I don't want the side effects of it. Well, any medication can have side effects.
Mm-hmm.
And I think that's just one thing to remind ourselves is it's worth trying if your doctor or provider recommends it. And when I do recommend it and want to write that prescription, I talk about it. And if the biggest side effect people have are myalgias or muscle aches, and so there's different things like CoQ10, which is a supplement that people can take to help kind of with those side effects. There's different types of statins. Some are fat soluble, which sometimes people can find more symptoms. And then there's some that are water soluble, so that your body kind of metabolizes it differently.
Mm-hmm.
I also tell them there are other medications out there that are cholesterol lowering medications if a statin doesn't work for you. But the risk benefit is, we do want to get that bad cholesterol down. And if diet and exercise haven't been enough, it's just something to consider. So that's one myth I think I really wish people would realize is that statins aren't bad.
Right. And I think, like you said, you had mentioned it, we're already trying exercise and lifestyle habits. What are some of the lifestyle habits that we can do either preventively or if we find out, okay, maybe we do have some high cholesterol?
Yeah, definitely. One of the big things that we focus on is recommending the Mediterranean diet. It's the heart healthiest diet. So that's really eating a lot of fresh fruits and vegetables, limiting our processed foods, avoiding them as much as possible, and then focusing on really lean forms of protein, lean meats, and then avoiding saturated fats like a lot of fried foods, buttered, a lot of processed foods, or cooking with like vegetable oils. And then instead, really focusing on those healthy fats, avocados, walnuts, almonds, fatty fish, olive oil. And little swaps here and there go a really long way with when it comes to if I'm baking banana bread for my son, I'll use olive oil instead of either butter or vegetable oil as the and it tastes the same. And there's conversion
Totally.
phone. Like if you just talk into Siri, it'll tell you what the conversion is. So, or if I'm making chili or burgers or spaghetti, getting either really, really lean ground beef or doing ground turkey, ground chicken. And in reality, I don't know how many people ever can tell a difference when you swap that. Um, and
Yeah.
which leads to one of the member questions, which I saw and cheated looking at Facebook.
Yeah. 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 No, we can totally go.
Yeah.
Just follow the path where it goes.
Yep. And I'll get to, I guess, in a sec with your other point to lifestyle modifications is exercise is huge when it comes to helping decrease our bad cholesterol. And in reality, when you look at your cholesterol panel, when your PCP, or if I order it for you so we can look at it, at your cardiology office, we're looking at your triglycerides, we're looking at your LDL, your HDL, and your HDL, which is the only one, the best way to remember it is high. You want that high, and it's the H for high. And the only way you can really bump that up is through exercise. So I'll have like these 80-year-olds who are like, oh, I go running regularly, swimming, hiking, and their HDL is super high. I'm like, I believe you. I can tell, which is
Hmm.
great. And so that's a way to help with getting that good cholesterol to combat some of that bad. And then the other thing is, decreasing stress because our stress hormones often can cause inflammation, which can lead to plaque buildup, but also can cause us, when we're stressed, to stress eat and maybe not make those healthier choices. And so knowing that stress is a huge component to healthy lifestyle modifications.
Yeah. What about, I thought of this because I actually had this conversation with my daughter today about sleep quality. We were talking about how sleep quality, if you're not sleeping well, a lot of times you have more cravings or you're not in a great mental space, so then you don't want to work out. Does sleep affect heart health?
Sleep very much dramatically affects heart health and not just getting the number of hours every night, but good quality sleep is really important. It's hard when you're a mom, with a newborn or whatever, or maybe people who are working night shifts, but studies have actually shown and looked at people who work night shift versus day shift, and there are increased risks of high blood pressure, high cholesterol, obesity, things like that. And a lot of it is linked to sleep. And so
Totally.
knowing that that causes that hormone release of cortisol and other stress hormones that your body is just trying to catch up.
Yeah, yeah. All right. So these are a lot of things that I think we already kind of know, but it's just a good reminder that sometimes I have to remind people. I actually had a conversation today about with one friend. She's like, I kind of just like don't really want to do it sometimes. Don't really want to exercise. I'm like, well, sometimes you don't want to go to work either, but you do because you need to pay your bills, right? And so sometimes like we might not really want to go for the walk or put our phone down or turn the movie off and go to bed, but sometimes I think framing it, and this isn't just, I try to explain cardio is not just to be skinny. Like my generation was like, oh, you just get on this bike or you get on the elliptical because you want to be skinny. At this point, we just need to be healthy, like getting that heart exercising with that cardio. Just a good reminder to frame all of it. But yeah, so let's dive into the member question. I think you're talking about the one about protein and red meats, right? So here was
Yeah.
the question. As we add on, as I'll just read it, as we focus on adding more protein, should we be concerned about the amount of red meat? And has any of the science on this changed?
That's a really great question. I'm glad someone asked it. Like you already mentioned, Becky, there's been a lot of changes in kind of as we're having medical advances and we're doing more research and we're finding what's working, what's not. I mean, it used to be where your doctor would smoke in the room with you and right? And people were told that eggs are bad, but that is not true. Eggs are good. They have 12 amino acids that we need, and they are such a great form of protein. And so to answer your question, it kind of depends on the person. If you have extremely high risk of coronary artery disease, which is the cardiovascular disease, and maybe already had a stent placed or a coronary artery bypass surgery, definitely talk to your cardiology provider about what they would recommend. But so for some of those patients, I recommend like maybe once a week. But everyone else, the big thing to focus on is probably 2 to 3 times a week is totally fine. And focusing on how lean the meat is, as well as the
Hmm.
quality of the meat, and portion control, which are all three really important things to look at how we view food in general, not just beef. And seeing, that if you're buying poor quality food, you might get more additives or not as high quality, like nutrient dense things like that, too. And so, and then the portion control piece, which is just good for all of our health maintenance with like weight maintenance too.
Yeah.
So, but like I said, if you're really craving more beef and you or your husband is a hardcore kind of like
Like,
Midwest potato kind
yeah,
of guy.
or like someone who hunts, right? But then again, a lot of
Yes,
times these hunters are bringing home like probably the best quality meat you can get,
yes.
right? Because it's literally like out of the
So
field.
lean.
Yeah.
Yes, so
Yeah.
lean. And so I think just like kind of like I said, if you're, making those other swaps for those other meals, like using ground chicken, ground turkey, and people don't even realize it. But like I tell my patients, you know what, I'll write your prescription for you for your anniversary to go to Shanahan's and have that steak and lobster mac, because life's also about balance. And I've seen patients who had like open heart surgery for a coronary artery bypass surgery go from eating, however they did, to completely almost like too limited, where they were so
Hmm.
anxious and stressed about it that they were then losing weight like drastically instead of,
Yeah.
really getting that nutrients to help them recover from surgery, but also help their heart recover, their body recover. And we kind of had to have a talk about that. Like you can still have some of these things, and let's just come up with a good plan to have a good balance. So
Yeah.
my recommendation is about 2 to 3 times a week and focus on if it's lean, the quality and portion control.
Okay. Awesome. Yeah, that's super helpful. Um, yeah, and I like you said, I think a lot of times the alternative, or even I know some people don't like fish, but I'm like, man, some good salmon. It's so good. And it's easy. One of the things I always share is like we eat really simply. And the value in that, like you save so much money by buying, I'll share like 5 pounds of potatoes versus, a bag of potato chips. I mean, it's just night and day. And this one is full of, fat and salt. And this one is it's just food. It's like real food. So I love those suggestions. Okay. So the other member questions, let me see. We had one. Okay. So this was actually good, is talking about our heart rates, right? When we're exercising, a lot of times we might have a smartwatch or even, sometimes even machines, if you're holding on to like those little diodes on like an elliptical or whatnot. Um, how do we know if our heart rate is too high? And is there a general guideline that we should be kind of balancing out with that?
That's a great question. And there is like a calculation you can do, but I like to throw away the calculation, because my rule of thumb is I want you to listen to your body and the symptoms you're having instead of focusing on a number. And that's just how I practice medicine in general with a lot of different things. If you feel really breathless, and let's say you and I are working out together and I couldn't even get a couple words out to you, I'm probably pushing it a little too hard. Or if you're feeling lightheaded or dizzy, you definitely need to back off because your heart rate may be going a little too fast. So I would say listen to your symptoms more than a number. Also, those numbers are hard, just like when calculating people's BMIs and everything is hard, where every body is built different. Everyone's kind of exercise capacity is different. So your ability to reach a certain heart rate may be easier than someone who's a marathon runner since they were a teenager where their heart is kind of has a lower baseline heart rate. The other thing to think about, and patients will tell me this, especially some of our older patients who may be on like a beta blocker, like metoprolol, carvedilol, propanolol. Part of that drug's job is to bring your blood pressure down, but also your heart rate down. So they're like, I'm trying so hard to get my heart rate up to blank, blank, blank. Well, I'm like, well, the medication you're on is not going to let you. So just
Hmm.
knowing that that can kind of contribute, but I would go off symptoms.
Got it. Got it. And is there a threshold as far as like exercising the heart? Like, one of the things we're doing in the Fit Club this month is 10 minutes of something that's going to get your heart rate going. Because, I've seen research, or doctors on like say Instagram or talk about how having those sprints in your exercise that kind of challenge the heart, even just for 10 minutes a day, can be super impactful. So that's kind of how we came up with that challenge. But how do you know if you're like, not, I don't want to say not pushing enough, but how do you know if you're really working out the heart? Is that also based on like exertion, you know, perceived exertion?
Yes, I would say that if you feel like you're not working as hard as you could be, or you're like, wow, I think I could push myself harder. I mean, this is what my coaches even say, like Orange Theory. Like, if you, after you did a set of weights with something, do you feel like you could push a little harder? And then that next day, try and see how you feel. What I love about the challenges, that we're doing too, is like you kind of get to be self-motivated to compete against yourself. Like, how can I keep improving? But studies also show HIIT, which is high intensity interval training, has the same effect as a sprint on the heart, which is kind of like you said, that quick, your heart has to adjust and go really fast, and then it has time to recover. And it also keeps the heart and your body guessing, which is also really good for your heart
I love
health.
that. Yeah.
Yeah.
Okay, great. Thanks for sharing. Because some of these things I think you just kind of almost know intuitively, but to know that there's actual science behind it, I think is helpful. Okay, so the last member question we had, which I might not even say this right, but tachycardia, is that how you say it?
Tachycardia. Tachycardia.
Okay. So someone had mentioned that they have that occasionally, and should they be concerned? Can you explain just like what it is? Should they be concerned? And is there anything, that they can do to help regulate that?
That's a really great question, and I'm glad this member brought this up. Tachycardia is basically a fast heart rate. So the way we kind of look at heart rates is bradycardia, which is basically anything less than 60 beats a minute, and then there's um, sinus rhythm, or just like normal kind of heart rate we want people in, which is 60 to 90 beats a minute. And tachycardia is anything over 90. And tachycardia is definitely expected when you're working out. You want your heart to be going faster. And so that's definitely expected. So another reason why I don't probably go off the number per se. But if you're just sitting and you're having tachycardia, then this may, and you're feeling symptomatic with it, lightheaded, dizzy, short of breath, or your maybe Apple Watch notifies you, definitely bring it up to your primary care doctor, primary care provider, your cardiologist, someone, just to, because they may want to further look into that. So tachycardia itself is okay when your heart needs to go fast. It's not okay when it shouldn't be going fast, or it's sustained going fast because your heart can't keep up with that. So a couple things that I think that are helpful is Apple Watches are incredible tools that we're actually using a lot more in medicine to see if patients wear at night, to help see like if they're having sleep disturbances, maybe suggesting sleep apnea. Sleep apnea
Hmm.
actually that is not managed well and not treated can lead to very serious heart issues, including uncontrolled high blood pressure, transformation of how your heart works, and as well as can lead to atrial fibrillation, which is a type of heart dysrhythmia that can become a form of tachycardia, which can be very damaging to the heart if just persistently going fast. And so having an Apple Watch, which can alert you if you're in a funny heart rhythm, if you're going too fast, things like that is really helpful. I've heard good things about other watches like Garmin, but we in cardiology really like the Apple Watch, and the advancements they've made is really good. So if you're maybe having intermittent tachycardia, having the Apple Watch is helpful to make a log for your provider.
Hmm.
And that could be like, what was I doing when it happened? How fast was it going? And how did I feel?
Right.
And
Yeah,
that,
because I think like you're saying, it's almost like if you're exercising, you're almost expecting it to come up. But if you're just sitting on the couch watching TV and all of a sudden you have this like racing heartbeat, it makes sense it would be alarming, right? Because it feels out of place. So yeah, that's good data. And one of the reasons I love when we get questions like this, because this is something that you or I might not have dealt with, but then all of a sudden we're sitting next to our spouse who's like, oh, my heart's racing, or our friend. And so I think just having general information like this is helpful even for future things. And so thanks for sharing. I never heard that before. Obviously, why you're the expert. And so that's super interesting. But I think just good to know in
that
general.
caffeine and alcohol can also impact that. So if you notice, I would also keep track, like, am I getting tachycardic or feeling palpitations, which are funny heartbeats, or feeling your heart beating? Is it right after I drink a cup of coffee, or is it after I had some alcohol? Is it in the middle of the night and I'm woken up because I'm breathless? Things like that are kind of when I would definitely reach out to someone. Also, our thyroids. One of the first things I check in a patient who's coming in with tachycardia or palpitations is a thyroid level, because sometimes if our thyroid gets out of whack, it can cause issues too. So if you're definitely worried about it or having symptoms, talk to your healthcare provider, because it may be something that needs to be further worked up.
Okay, yeah, perfect. Yeah, thanks so much for clarifying that. Again, I think so much of this is like one notating it and like, but literally writing it down, even in notes on your phone or on a notebook, because I don't know about you, but sometimes I go to a doctor's appointment and they're like, "How are you?" I'm like, "I'm fine." Whereas like 3 weeks ago, I was like, "Oh, I thought I was having a heart attack," but you forget like time and distance away from things like that. So yeah, writing things down, I think, especially if they're um repeating, I think is super helpful, right? Wouldn't you, do you agree? Like if a patient comes in like, well, this is what I've been dealing with. Here's when it happened. Like having the data, I think can be helpful.
It is. And that's what I ask patients for when they're managing, like I may be making blood pressure adjustments and I'm prescribing a new blood pressure med. I'm like, I want to see a log of your blood pressures, and how you're feeling with it all and like what time of the day it is, because it just gives us more data to kind of help us with our diagnosing. Because that's my favorite part of my job, is it's a little bit of a discovery detective piece where I'm like, okay, what's causing these symptoms in my patient? And I get to like order the test to kind of narrow it down and figure it out. And a lot, we can often diagnose certain things just based on a patient's history of their symptoms. And so it's really helpful to have like as much data as possible.
I love that. Yeah, that's super helpful. And just a reminder, like to be writing. And that's one of the things I always tell people with macro tracking is the more data I have, the more I can help. Because if someone's like, oh, I'm feeling low energy, and I can go in and look at their food, I say, well, could this be why? Because I have the actual what you've been eating. Whereas someone's like, oh, I'm feeling low energy. I'm like, well, what have you been eating? Oh, I don't know. Like, so the more data, the better, right?
Yeah.
Okay, so I know we're gonna be coming up on time, but strength training, which you obviously have a background in with bodybuilding. How does strength training impact the heart? And then obviously we have cardio. So, what is the balance between those two? What would you recommend, for general heart health and kind of your personal um, rhythms?
Yeah, definitely. The American Heart Association recommends doing both, and that they're both are extremely good for heart health. Both can help reduce cholesterol levels. Both can help decrease your blood pressure. Both can help with weight management and mental health. I literally had a patient a couple months ago who was like, "I really want to come off one of my blood pressure meds, and I'm really going to work on weight loss." And he busted his butt with exercising, eating right, and he came off two of his blood pressure medications. And I was really proud of him. And that really does make a huge difference. And so also remember us as women, as we age, our hormones change. And I tell a lot of my women, female patients who come in and they're like, hey, I feel like I can't lose this weight. And I'm like, well, are you, and they're like, I'm walking every day or I'm swimming every day. I'm like, well, what are you doing about strength training? Because remember, muscle is the most metabolically active substance there is. And so if we're not using and we're doing resistance training and we're not getting enough protein, then we're not building that and then we're not increasing our metabolism. And so both are really important for our heart. And the American Heart Association recommends aiming for 30 to 60 minutes of daily activity. And so the workouts that you do at 5 in the morning for us, or people going for a walk at lunch, just like finding and make sure every day you get even that little bit is really helpful.
Yeah, I love that. I'm like, yeah, yeah. Because this is what I like preach all the time. It's like you need both, right? And it's like, and I do want to talk about, women specifically. Are there different, I'll ask this question, then I'll go back a little bit. Are there different concerns or things that are specific to women versus men? And probably, hormones can be a huge part of that. But the thing that frustrates me, I just had a lady tell me this the other day, well, when you're 50, your body turns to mush and there's nothing you can do about it. And I was like, no, that is not actually true. Like it's just not. So I'm just like, the more we can, share the data that you have, you cannot control everything. Like you said, family history, some lifestyle, factors, but there's a lot we can do our best, not to control, but we can manage. So tell me a little bit about heart health and specifically in women.
Yeah, definitely. So I want to give a couple statistics like you already mentioned, but I think sometimes numbers are really helpful. So I wrote down some statistics, but like we talked about in the US, heart disease is the leading cause of death in women. And like I said, heart disease meaning plaque buildup that can lead to a heart attack. In 2021, 310,661 women died of heart disease in America alone, which is about 1 in 5 female deaths, which is just crazy to me. So it is a really important thing that we need to really focus on and help with our mothers, our sisters, our friends to help support. Pregnancy often has different complications like high blood pressure, also known as hypertension, diabetes, preterm death, all those things actually are can cause increased risk of developing cardiovascular disease. So I think sometimes we forget, oh, wow, I'm pregnant right now. There is risk to that could be to my heart. So am I listening to my body, following up with my OB with certain, questions and making sure that I'm also really taking good care of my heart now too. Hormonal birth control can lead to can lead to blood clots. So, which could be in our lungs, in our hearts, things like that, which and is the higher risk, especially in those who smoke. And smoking is a huge risk factor for cardiovascular disease. And just knowing that with the contraceptives is really dangerous. And then menopause. So that low estrogen level that happens during menopause can increase the risk of cardiovascular disease. Estrogen is actually very cardioprotective. And so when that drop happens, that's often why we see an increase in cardiovascular disease in women. So making sure that, you're talking to your healthcare provider about like risk factors and is there anything else that you need to do other than what lifestyle modifications you know. But it also can increase, like I said, the high blood pressure risk and then reduce glucose intolerance, just as we are getting older, and estrogen can play a role in that, which then can lead to, weight maintenance issues, obesity, which then can also lead to cardiovascular disease.
So I know maybe this is just because I'm approaching this age. So I'm 45. I'm not in menopause yet. I don't know when that will happen. But because there's a window. It's anywhere from like what I think like 35 to 55. And it's a huge, huge, like wide open barn door. But maybe because this is more relevant to me and my community, lots of conversation about hormone replacement and previous studies that might have come out that were not as accurate as once described. There's a couple like kind of big time authors who put out really, I feel like, empowering books to not necessarily tell women, yes, you should do hormone replacement, but yes, you should be able to have a conversation about it and have options. So I would love to hear your take on it. Obviously, you're not prescribing something specific to a specific person. That's for them and their doctor. But what are your thoughts on that as far as, because from what I've heard, it is very heart protective. And so my thought personally is like, well, if I can, when I get to that point, even use some estrogen replacement. And I think they typically have to balance it out with a little bit of what the progesterone um, to protect my heart. I'm like, I'm like, why would I not? But I'd love to hear your thoughts on it.
Yeah, it's a great question. I think as long as you're really keeping your different providers in the loop with what one provider maybe wants to do with your cardiologist, or your PCP, if like you're seeing an endocrinologist about this, versus maybe talking to your PCP about it, then really keeping your cardiologist in the loop because there are different forms of how we get or they can administer the hormone replacement, and that can definitely be contraindicated with certain medications or your cardiovascular health. So I would say that it is definitely has its role and can be beneficial. And so as long as you're kind of keeping everyone in the loop, that's really important so that they can kind of talk to each other. There are so many times I call some of my patient specialists to talk, with the neurosurgeon about their anticoagulation, or I'm calling their kidney doctor about their blood pressure to be like, how can we work on this together? So I think, and I've also talked to endocrinologists about hormone therapy. So there's definitely a place for it, and they'll help you kind of guide through that and just keep everyone in the loop.
Yeah, yeah. One, I just have to tell you, I think you're an amazing provider. Like I can already tell that when you care, you're doing the legwork. You're making everyone communicate because honestly, and I really feel for the medical field. Like for so many, it's very high stress, very high tempo. You don't always have the time to to do all these little. But I just want to say, I think you're amazing, and you give me hope for like our medical system that you're really taking care of people. So I'm trying to throw that in there.
Oh, thank you, Becky. That means a lot.
Yay. Okay, so let me see if I'm looking at our questions in my notes. Is there anything else that you can think of that we haven't talked about that you think would be helpful? That maybe or just, some closing thoughts for our general heart health.
I would say that, making sure that we really are focusing on our body as a whole, and a huge part of medicine in general is preventative medicine. I know sometimes our society can be a little bit of, well, I just want a pill to fix this, but just kind of looking at yourself as a whole, that, all these different areas of your life really do impact your health. And so that means, de-stressing, and that can mean anything from what is it for good self-care for you, which I'm bad about doing self-care and I've had to get better at it. If that means going for a walk, having a cup of tea, reading a book, talking to a friend, um, reading your Bible if that's important to you, or whatever helps de-stress your life. But also looking at, are there things in my life that I need to maybe take out or set boundaries with? And that could be like relationships, that are maybe kind of toxic and stressful for you, because this is your health and you want to help with that. Um, and then like obviously not smoking. And if you struggle with smoking or tobacco use, like really leaning in and talking to your healthcare provider, because that is the healthiest thing you can ever do. It's one of the major risk factors for coronary artery disease. And then, like we talked about, eating a heart healthy diet and really focusing on whole foods, like you mentioned earlier, which I think is important, is cooking at home as much as possible. I know sometimes with people's careers and such, it's really hard when you're traveling a lot or you're busy on the go, trying to get lunch here and there. But if you can like bulk meal plan,
Mm-hmm.
I even have a patient of mine who told me that after his heart attack, he just changed his whole kind of perspective on food. And he flies a lot, but he brings his own meal on the airplane, even. And so, just like really making those little swaps and like making that priority in our life is really important. Also, I will say being mindful of salt intake in our diet is one other thing, just because it can lead to increased blood pressure if you have way too much salt. If you think about it, when you eat a ton of salt, you get thirsty. Water follows salt, so either you get thirsty, you drink more fluid, or your body pulls fluid from the other tissues in your body into your bloodstream. Your heart has to pump all that extra blood. Some of it backflows and then it goes into your edema, or can cause edema and swelling in your legs too. But it's also having to work harder, which increases that blood pressure. So, being mindful of salt. And then, like I said, the exercise and aiming for 30 to 60 minutes a day of activity. And that could be going for a walk with a friend, or it could be doing a really great workout with Becky in the morning, or doing a yoga class or Orange Theory fitness class. So those are really important. And then just I want to briefly talk about like the mechanism of a heart attack, because I think sometimes people don't understand if they've been put on like a aspirin and a statin and maybe a beta blocker blood pressure med because they have higher risk. But when you have plaque in your coronary arteries, it's unstable and it's sticky and it's inflamed. And so the blood comes along, those little platelets want to stick to that plaque. And if that plaque like pops off because it's unstable, starts kind of rolling through your blood vessel, then all those platelets are just attaching to it. And that's what causes a blockage, and
Mm.
that can cause a massive heart attack. And in any of the coronary arteries, which is very scary and detrimental. And definitely, you want to get care at a hospital immediately and get a stent placed, a balloon angioplasty, coronary artery bypass surgery if you need that. But that time between when it first happens to when you get to the hospital, there's decreased blood flow to that heart muscle, because those coronary arteries are feeding that heart muscle. So that can lead to heart failure if it's not repaired. And so I think sometimes people need to understand like the mechanism of what we're trying to prevent. And I had a patient the other day and they're like, I just want to get off some of my meds. Why do I need to be on an aspirin? Why do I need to, keep taking this? And that's because it's helping prevent
Hmm.
the platelets from sticking to if something were to go. But the statin or a cholesterol lowering medication helps decrease that inflammation. It stabilizes the plaque. It helps it from being sticky, but it also helps prevent future plaque from growing. So just to give a little bit of like physiology to what a heart attack looks like.
No, that's super helpful. And also, when you were talking, I actually had two questions.
Yep.
So signs that I'm having a heart attack? Because, like you mentioned with your mom, which I was like tearing up when you're saying, like, first of all, no wonder why you do such an amazing job, because this is like personal to you. But what are some of those signs that we don't, I mean, we see in a movie like, oh, gripping the chest, like, but really, what are some of those early signs that we could look for? Not that we're going to like, cry wolf every single time we have a little heartburn, but to know, okay, I feel like our gut sometimes will say something is not right. So what should we look for in ourselves or even our people around us in our family that could be signs of that someone's having a heart attack?
That's a great question. I think you were reading my mind because I wanted to go into next about how women often have very atypical anginal. And anginal means basically decreased blood flow to the heart, symptoms that could be a heart attack. Like you said, textbook heart attack is an elephant sitting on someone's chest, horrible pressure. And that's actually more common in men than women.
Okay.
In women, oftentimes it's that kind of acid reflux symptom, pain that goes from the chest to the jaw, or just having jaw pain, pain that radiates from the chest to either arm, numbness and tingling in your hands. Um, so those are kind of some of the more common symptoms. I think the big thing, especially with like acid reflux, and I tell my patients with that if they're having some, but they're like, but it goes away with Tums, is kind of a key point, like a key piece. But if you're ever worried and it's something like you said, you know your body better than I do, better than your ER doc you go see, your cardiologist you go see, and those you know your body better. So listen to your body. If something feels wrong, better be safe than sorry and just go to the ER to get checked out. Especially if you have any risk factors, like we've kind of talked about. But also, I think that women often minimize symptoms, and that's what
I was just going to say that. Yeah.
my mom was doing just that. She was like, but she was having it for like hours on end and it wasn't getting better. And I was like, Mom, this just doesn't sound like right. The other key piece and something to tell your healthcare provider, if maybe you don't have like a full-blown blockage, but you have some plaque buildup that they need to further evaluate, is all of a sudden, you're walking across a parking lot, you've always been able to, but all of a sudden you are short of breath, and that is not normal for you. Or you're having a little chest tightness, and that's not normal for you. Mentioning it to your doctor because they may want to do further workup to make sure that this isn't developing plaque.
Yeah. And I'm just so glad that we brought this up because I feel like you said, we minimize, a lot of times women and moms, even as partners and employees, like we just gotta suck it up and do what needs to get done, right? We're like very resilient, very um kind of go-getters and caretakers, but not really good at taking care of ourselves, right? So just a reminder, like if you ever have that sensation, I'm talking not to you, but like people watching, if you ever have the sensation something is not right, just go ask. The worst that's going to happen is they're going to be like, oh no, we've run the test and you're fine. But if there's ever a question, you'd rather know that it's nothing, and maybe even if you feel a little silly, whatever, at least you know that you're safe rather than be like, no, it's fine, it's fine, it's fine, and it's really not fine. So I'm so glad that you brought that up. One time I was having chest pain, this is years and years ago, like it right here, like in the center, and I didn't think I was having a heart attack. I'm like, something is definitely not right. I ended up going, I think, to urgent care or something. And it was like a bruised chest wall from we had been moving. So lifting very heavy things. But I'm like, well, at least now I know I'm not having a heart attack, right? So that's what your healthcare is there for, right? To be used. But
I
one more
forgot
quick question.
real
Oh, go
quick,
ahead.
another symptom I just don't want to forget, and I'm happy if we need to go over a little bit, but so nausea is also a huge one, and feeling diaphoretic or really sweaty. So if that's also kind of you're just sitting there and you're feeling like super nauseous and sweaty, like that could also be a symptom of that. So
Interesting. Okay, good. This is all good to know. But the one thing I wanted to come back to was the salt question because now we see a lot of either like electrolyte packets or even like salt replacement, like the element packets. I'm just curious what your thoughts are on there for like salt replacement, and is that different than like salt in our food? And if there's like a threshold or a guideline for how much salt is too much, or is that personal to the individual?
it definitely is personal to the individual if they have known maybe heart failure where we really want to limit how much salt, how much fluid their heart has to pump because it's just squeezing a little weaker than maybe yours or mine. That's something as well as like kidney disease can also be impacted by salt. So definitely if you have any of those issues, talk to your doctor. But usually in those situations, we don't want more than 2,000 milligrams of salt a day for us, we can probably have more than that. But the big thing is looking at labels too and just seeing like, wow, like once you start keeping track of how much salt you eat, it's kind of crazy. Or if you never
Hmm.
notice, you're kind of swollen the day after you have like takeout Chinese food, that's
Oh my
probably.
gosh, yes.
And
Yeah.
just kind of keeping an eye on, especially if you have like risk factors like you have maybe your doctor told you that you're borderline have high blood pressure. Like keep a little closer eye on that and see if that helps. But when it comes to salt replacement, I really like liquid IV, those other many or electrolyte replacements are really helpful. But I will say be mindful and use them more so after like really extensive strenuous exercise or like during the summer if you're really sweating a ton because that's when you're losing a lot of salt and it'll help you kind of get some of those electrolytes back. I wouldn't just kind of drink it throughout the day with your water because that is going to increase your salt intake.
Got it. Got it. Yeah, that's super helpful. I think, yeah, for example, we used to always have Chinese food on Christmas Eve, and because it was just like a tradition. And my husband finally said, "Why do we have Chinese food? We always like everyone in Christmas photos is like, like
Yeah.
so much salt." Anyway, thank you so much for being here. This was super informative. Like, I really appreciate you sharing your expertise with us because I mean, I learned so much, and I also think just having the conversation and just reminding us of the things that we might already know, and then learning the things that we didn't. I just really appreciate it.
Oh,
Yeah,
well,
and
thank you.
again, like I said, you do such a good job. Like I can just tell. Like I
Oh,
want you to be my my provider if I ever need it.
you know my number. Well, thank you
Right, right.
for having me, and I just love this community. And if anyone has any other questions, or I'm happy to talk to them too. So,
Okay, awesome. Thank you so much. And I'll when I post the video, if anyone has questions, they can even post it on the feed, and that way we can even have a written dialogue too. So then sometimes it's nice for other people to see if there's anything else that pops up. But yeah, okay, I will end the recording. But I just want to say I so appreciate you and thank you for being here. Okay, let me see how I where are we? Oh, there it is.